What is systemic lupus erythematosus? Systemic lupus erythematosus, or SLE, is a systemic disease, which means that it affects several body systems such as the central nervous system, urinary system, respiratory system, and cardiovascular system. Remitting and relapsing is a term used to describe a pattern of a disease characterized by cycles of improvement or remission and worsening or relapse. Autoimmune disease, which means it occurs when the body's immune system mistakenly attacks its own healthy cells and tissues. Organ damage occurs primarily due to a type 3 hypersensitivity reaction and, to a lesser degree, a type 2 hypersensitivity reaction. Type 3 hypersensitivity reaction, also called immune complex-mediated hypersensitivity, occurs when immune complexes form and deposit randomly in tissues or blood vessels, leading to inflammation and tissue damage. Type 2 hypersensitivity reactions, also known as cytotoxic hypersensitivity reactions, are a type of immune response in which antibodies, IgG or IgM, are directed against antigens on the surface of the body's own cells or tissues. This leads to cell destruction, functional loss, or tissue damage. SLE associated with deficiency of early complement proteins, for example C1q, C4, C2, due to their consumption leading to decrease the clearance of immune complexes. What is the classic presentation of systemic lupus erythematosus? The classic presentation of SLE includes facial rash, which spares nasolabial folds, joint pain, and fever in a female of reproductive age. The prevalence of systemic lupus erythematosus is high in Black, Caribbean, Asian, and Hispanic populations in the USA. What are the signs and symptoms of systemic lupus erythematosus? The signs and symptoms of SLE are in these words. Rash or pain. R stands for rash, where we have two types of rashes. The first is a redness on the face that includes the cheeks and nose called malar rash, and the second is a red raised circular or coin-shaped rash called discoid rash. A is for arthritis, or non-erosive inflammation of the joints, meaning it doesn't cause destruction of the joints and doesn't cause deformities in the joints. S is for serositis, which means inflammation of the serous membranes like pleura and pericardium leading to pleuritic and pericarditis. H is for hematologic disorders or cytopenia like anemia or decreased red blood cell count, thrombocytopenia or decreased platelets count, leukopenia or decreased white blood cell count. O stands for oral and nasopharyngeal ulcers, which are usually painless. R stands for renal disease, which we will talk about later in this video. P stands for photosensitivity, which means flaring of the symptoms like rash due to exposure to the sunlight. A, which stands for anti-nuclear antibodies. I letter stands for immunologic disorder, to remind you of the antibodies present in SLE like anti-double-stranded DNA and anti-Smith and anti-phospholipid antibodies. N stands for neurologic disorders like seizures and psychosis. As we said earlier, the immune complex circulates in the body and then deposits in different organs of the body randomly, causing inflammation in the organs where it is deposited. For example, if it is deposited in the skin, it causes a rash. If it is deposited in the joints, it causes arthritis. And in the serous membranes, it causes pleuritic and endocarditis. The deposition of the immune complex in blood cells causes them to break down, resulting in a low blood cell count or cytopenia. And the deposition of the immune complex in the mucous membranes causes oral and nasopharyngeal ulcers, and its deposition in the urinary system causes renal disease, and its deposition in the central nervous system causes psychosis and seizures. What are the common causes of death in systemic lupus erythematosus? Renal disease is the most common cause of death in patients with systemic lupus erythematosus, followed by infections due to leukopenia, due to the destruction of white blood cells by the immune complex, and the last cause is cardiovascular disease due to accelerated coronary artery disease because of the vasculitis, which happens also due to deposition of immune complex in the coronary arteries. What is lupus nephritis? Lupus nephritis occurs due to the deposition of immune complexes consisting of DNA and anti-DNA antibodies in the glomeruli, leading to nephritic or nephrotic syndrome. In nephritic syndrome, we can see hematuria, while in nephrotic syndrome, we can see proteinuria. The most common and severe type of glomerulonephritis is diffuse proliferative glomerulonephritis. What is Libman-Sacks endocarditis? Libman-Sacks endocarditis is a form of non-bacterial thrombotic endocarditis that usually involves the formation of sterile vegetations on the heart valves, most often the mitral and aortic valves, and can be present on either surface of the valve, but usually on the undersurface of the cardiac valves. What is neonatal lupus? Neonatal lupus is a rare autoimmune condition that occurs in newborns because of the passive transfer of maternal autoantibodies, primarily anti-Rho or SSA and anti-LA or SSB during pregnancy. These antibodies cross the placenta and affect the fetus, potentially causing a range of transient or permanent clinical manifestations. What are the signs and symptoms of neonatal lupus? Congenital heart block periorbital rash that is diffuse around the eyes. Transaminitis, which refers to elevated levels of liver enzymes, specifically ALT and AST, which indicate damage or inflammation in liver cells. And finally, cytopenia or decreased blood cell count at birth. Finally, could you please write your opinion about the video? And don't forget to hit the like, share, and subscribe buttons.